Hello everyone, welcome to our channel, Lesson Insights with Cadet now. So you're welcome to our lesson today. We're going to look at pathophysiology of congestive cardiac failure. So before we go into the details of the pathophysiology, let's just look at the overview of CCF. So this is a heart diagram that I will be referring to throughout the study, throughout the lesson. So you will use it throughout the lesson. So let's define what CCF is. So first and foremost, CCF, the reason we call it congestive cardiac failure is because there is congestion in and around the heart due to the failing myocardium. Then now in the definition, it is a chronic condition in which the heart muscles become weakened and loses the ability to pump blood efficiently throughout the body in order to meet the body's oxygen metabolic demands, characterized by manifestation of of volume overload, inadequate tissue perfusion, and poor exercise tolerance. So here, this condition is a chronic condition first and foremost, and then it results in this condition, the heart muscles become weakened and loses the ability to pump blood. So when it loses the ability to pump blood as the body requires, there will be low oxygen for metabolic reactions in the body, and this will result in inadequate tissue perfusion, resulting into necrosis of some tissues. And then there's also poor exercise tolerance and fluid overload or volume overload because of retention of fluids by the kidneys. So CCF is caused by conditions that affect the heart. So there are intrinsic and extrinsic causes. Some causes are intrinsic, such as coronary artery diseases or valvular diseases, meaning that in the heart or on the heart. And then other conditions such as hypertension, which can affect the heart. So having known that, now we can go into our pathophysiology. So CCF results from a variety of cardiovascular conditions, including chronic hypertension, coronary artery disease, and valvular diseases. So these are some of the causes. So as CCF develops, the body activates the neurohormonal compensatory mechanism. So this system is the one that we are going to concentrate mostly in the first part of our pathophysiology, so that you can see how this system is affecting the heart and how it will lead to worsening of the failing myocardium. So CCF results from decreased blood volume being ejected from the ventricle. So as the heart is pumping or ejecting less blood, CCF will results from the heart failing to pump sufficient blood. The decrease in blood being ejected by the ventricle is sensed by the baroreceptors in the aortic and the carotid bodies. So when the heart, the circulatory system has these two baroreceptors, which are located on the aortic arc and in the carotid artery. So these two receptors sense the pressure in blood. So when the pressure drops, these two baroreceptors will sense that there is reduced blood flow, or the pressure of blood has reduced. So when this happens, the sympathetic nervous system is then stimulated to release epinephrine and epinephrine. So these are the two hormones that are released due to the reduced or lowered pressure that is sensed by the baroreceptors. The purpose of this initial response is to increase heart rate and contractility and support the failing myocardium. So these two hormones, just a bit, we talk about these two hormones, which is epinephrine and norepinephrine. These are the two hormones that are released, and epinephrine is sometimes called adrenaline. So this increases the heart rate. It also increases the contractility, meaning the strength of the myocardium, and it also supports the myocardium, which are the muscles of the heart. The sympathetic stimulation causes vasoconstriction in the skin, GIT, and kidney. So not only does the sympathetic stimulation cause increased heart rate, contractility, and support the myocardium, it also causes vasoconstriction in the skin, GIT, and kidney. So when there is vasoconstriction, meaning the blood will be going through the blood vessels with a higher pressure, with increased speed, with increased pressure, meaning that there will be hypoperfusion, or that will result in hypoperfusion. So a decrease in renal perfusion, which is hypoperfusion, due to low cardiac output and vasoconstriction, then causes the release of renin by the kidneys. So because now here we have hypoperfusion of the kidney, reduced renal perfusion due to the low production, low ejection of the blood by the heart, there will be release of renin by the kidneys. So when the kidneys now release renin, renin will break down angiotensinogen to secrete angiotensin 1. Angiotensin converting enzyme converts angiotensin 1 to angiotensin 2, a potent vasoconstrictor, which then increases the blood pressure. So in the previous lesson, we learned about the renin, angiotensin, aldosterone system. So here it also comes into play. So you find that renin will break down angiotensinogen to release angiotensin 1. Angiotensin 1 will be converted to angiotensin 2. So angiotensin 2 is a potent vasoconstrictor, which then increases blood pressure because the blood vessels have contracted. Angiotensin 2 also stimulates the release of aldosterone from the adrenal cortex, resulting in sodium and fluid retention by the renal tubules and stimulation of ADH hormone, the antidiuretic hormone. So here we are saying there will be fluid retention and there will be stimulation of the ADH. ADH also increases the retention of water, meaning we are going to have a lot of fluid being retained in the body. And due to vasoconstriction, there will be high pressure that will increase blood pressure. So these mechanisms lead to fluid overload seen in CCF. So if you've seen there's fluid overload, because of fluid retention, now we have fluid overload and high blood pressure. Fluid volume overload will result in increase of blood going to the heart in the circulation, meaning there will be increased blood in the circulation, which increases stress on the ventricular wall, causing an increase in the workload of the heart. So now, remember, this is a failing myocardium. The heart is failing. And then now it's now receiving an increased amount of blood to the heart, meaning this heart will now have double the amount of work or more work. So now there will be more stress on the heart to pump all that blood that is coming to the heart. As the heart workload increases, the contractility of the myocardial muscles decreases. So as the workload increases, the contractility decreases because now the stress is too much. Now the muscles can no longer take it. So the contractility of the myocardial muscles will decrease. So decreased contractility results in an increase in blood volume in the ventricle. Sorry, decreased contractility results in an increase in the blood volume in the ventricle, causing the myocardial muscles to stretch and increase the size of the ventricle. So because now here our heart is failing to our heart is failing to contract, the contractility has reduced massively. So now how will the heart accommodate the increased blood that is coming to the heart? It will cause the ventricle size to increase. It will stretch so that it can accommodate all that blood. I mean, like the way the balloon stretches when you put water, that's how the ventricle will be. It will stretch and increase in size so that it will accommodate all that blood in the ventricle. And that is what we call ventricular dilatation. The ventricle will dilate, increase in size so that it will accommodate the increased blood. This increased size of the ventricle further increases the stress on the ventricular wall, adding to the workload of the heart. So here we're saying the ventricle has now increased. It can accommodate more blood. So how will the heart pump this blood that is a lot in this ventricle when the myocardium is failing? So now this will get worse because the stress on the ventricular wall will increase to pump all that blood that is in the ventricle chamber. So how does the heart compensate for the increase in blood in that ventricle? It will now cause the muscles, the myocardium, to increase in size, in thickness. So while the chamber has stretched and increased in size, the heart will compensate by increasing the muscle thickness. And that is what we call ventricular hypertrophy, meaning the cells of the heart muscle now increase so that it can support, it can improve the contractility to push all that blood that is coming into the heart. And that's why we usually hear to say in heart failure, the heart grows. It becomes bigger than its normal size. It's because of such compensatory mechanisms. So now as the heart now increases in size and the thickness of the cardium, the myocardium increases, the heart now will have to pump all that blood. So failure of the heart to pump more blood causes the body to stimulate the heart to work harder. Thus, the heart cannot respond and failure becomes worse. So here, like I have said, so here the heart becomes bigger. The myocardium, the cardiac muscle becomes bigger in order to compensate for the increased chamber so that it can pump blood. So now failure to pump that blood will now result in the heart working harder and harder. And because it keeps on trying and trying, it will now fail. The failure will become worse. So now just a quick summary that now we've learned of this pathophysiology, just a quick summary we go and refer back to the heart. So our heart here. So what I meant when I said ventricular stretch, when the ventricular dilatation or ventricular stretch, here is the ventricle. So if this ventricle will stretch, and then when it stretches, this myocardium here will have to increase in size, causing the muscle to increase in size, which we are calling ventricular hypertrophy, in order to help the blood that is in here to be pushed out. So that's the easiest way we can learn how we can learn about the pathophysiology of CCF. So we have come to the end of our topic. We have come to the end of our topic. Thank you for staying with us and watching the video. Please subscribe to our channel, Caleb Mlonga. We're also offering tuitions. You can just call the number that will be in the description of the video in order to access our services. Subscribe, keep watching, and refer to others. Thank you, and watch out for the next video.